And the Democratic Alliance's Gauteng Shadow MEC for Health, Jack Bloom, joins us now in studio. Good evening and welcome to The Full View. Let's start off here and just listening into that package there by Griselda Lewis. Is it possible at all to determine how there was this outbreak, or what led to the outbreak? Because what we're hearing is that there's a myriad of issues, but nobody is telling us that this is the specific reason that it could have happened.
Well, when I visited there last Friday, the CEO told us that in fact they were getting 2 cases per month from January of antibiotic-resistant Klebsiella, 2 cases per month, but he said it was under control. It was between January and October, and then suddenly in November it started to jump, and then it jumped in December. That's when they got really worried, and you know you have to send it to the laboratory to properly diagnose. So in fact they don't really know why there was this jump, except you can really guess, because quite frankly hugely overcrowded. You know, 44 beds. When I was there, the nurse said we can have over 100. So, and in terms of international guidelines, you should have at least a meter between beds, and she said, oh, no, they're right next to each other. So, I mean, obviously what happened, I think, is that there was cross-infection, and it jumped, you know, 1 gets infected, 2 gets infected, then 4 get infected, and unfortunately 10 babies died. So I think, but they haven't really isolated it, and this is one of the problems at the hospital, is they don't have a proper isolation unit. They were just putting, you know, babies in a makeshift isolation unit, which is not what you should be doing. I mean, the problem at the hospital is space, because they need to expand, and they need to have beds properly spaced and a proper isolation unit.
So then the concern that's raised by the MEC as well about the spacing in between the beds, the question then is that then how do you solve that issue? How do you solve the issues to ensure that there's no cross-infection that happens? What about the feeding scheme? Is the feeding scheme working at all?
Well, look, let me give an example. We all know the problems at Tembisa Hospital. We all know that it's a very crowded hospital, and in the casualty section there's patients on the floor. The President of the country, Cyril Ramaphosa, visited there in May 2018, and people told him, you know, we're overcrowded, we need extra space. I mean, there's no substitute for expanding the wards, particularly the labour wards. So the shortage of staff is actually acute, and what we were told by the CEO when I was there was that in fact 103 posts were approved last year. They were approved, but there was no money for them. And the CEOs told us that they need actually about 150, which should help immensely with the staffing. But at the end of the day, if you haven't got enough space for beds, you need to plan ahead. And I think that's where I would fault the department, is that the warning signs were there for years, quite frankly. End of the day, expand the wards. You have to do that. Because
something that the ANC-led government in the province would always hamper on is the migration of South Africans who move into the province. I think they said the statistics are close to over 100,000 people who come into the province every year. But then what does this then mean when it comes to planning? Because obviously this means that people would be using some of these facilities, including Tembisa Hospital.
Well, the real problem is that the population has really expanded around that area, and there needs to be another hospital. There needs to be a district hospital. This is a tertiary hospital, but they take all cases. That's the real problem. This morning I was with DA leader John Steenhuisen. We were visiting the abandoned Kempton Park Hospital, which we've been calling for this hospital to be reopened for years. And you really do need another hospital in the area. It's the other hospital nearby is Inver Hospital, also grossly overcrowded. So the solution is reopen the Kempton Park Hospital. That would help. And I mean,
what was the attitude of the previous MEC? Because I think it was during the previous MEC's tenure that this was raised.
Well, you know, the hospital was closed over 20 years ago. I've raised it ceaselessly in the legislature, and every MEC has made promises.
Promises to what? To
reopen, to rebuild it, to demolish it.
So was there commitment to reopen it?
There has been commitments to do something about it, but none of these promises incidences have happened. I must say that the present MEC, Dr. Bandile Masuku, has looked very seriously at something which I think is the solution, a private-public partnership, because there isn't government money to actually refurbish that hospital. It's quite expensive. And I do hope that he looks at a private-public partnership, a win-win situation for everybody, and we can reopen the Kempton Park Hospital, the hospital as soon as possible.
And let's quickly speak then about primary health services. For instance, what clinics are offering. Is it possible at all to have clinics offer neonatal services as you have with the hospitals?
Well, look, I think people need to go to the appropriate level of care, and that's not happening for various reasons. Actually, one of the complaints at Tembisa Hospital is that mothers arrive there, haven't been for antenatal care. They just arrive there with complications, and that really is a problem. So I think we can do a bit more with educating people to go to clinics. These are uncomplicated cases, but people must have confidence in these clinics. The reason why people bypass the clinics and go to hospitals is they don't have confidence in the clinics. The clinics need to have proper services, they need to have adequate doctors, and then I think we can re-establish the chain of care so that people go to the appropriate levels and we don't have such overcrowding at certain hospitals.
Do you know, as the Democratic Alliance at least, how many hospitals the province needs?
Well, a former Minister of Health, Aaron Motsoaledi, said we need 6 new hospitals.
Just in this province?
In this province, we need 6 new hospitals. Look, the population has basically doubled over the last 20 years, and we've only had 2 new hospitals built in the last 10 years. So I think we do need new hospitals, but obviously we need to staff them properly. We need to get the equipment, and I don't see that level of planning that is happening. It worries me immensely because we're not doing enough training. And that when the present generation of senior nurses and doctors retires, I don't know if we can replace them.
Jack, just quickly on an unrelated matter, how the national government is responding to the coronavirus. Your take on this? I see the minister argued that there's no need to panic. However, though, that the department is on high alert.
Well, I would hope so, especially at airports, because I think I think what they're doing is they're scanning people with high body temperatures at airports. I hope that's been doing at all ports of entry to South Africa, because we have to take this very seriously. I remember the time we had the SARS virus, similar steps were taken. This may or may not be as serious, but let's take all precautions necessary. Worldwide, people are treating this very seriously.
Well, thank you so much for your time. That is Jack Bloem, the Democratic Alliance's Gauteng Shadow MEC for Health.